Welcome back to our podcast, Health Unplugged, Our Superstars. Let's start with a confession. Most of us won't agree easily. A lot of us try to cancel the dental treatment. It's not because of the reason that we are busy, but because of the fear. The sound of a drill, the pain, the discomfort, the stories from our childhood, or even the friends that give us never ending stories. But the truth is, today the dentistry is completely different from how we had imagined earlier. Today's episode is about root canals, advancements in anesthesia, and importance of implants. To discuss this topic, we have Dr. Tamilazhagan with us, who is a specialist endodontist and cosmetic dentistry expert. Welcome to the podcast, sir.
Hi.
So, doctor, according to you, what is the success of the root canal therapy?
So previously, if any patient comes or anything, the dentist used to extract the tooth, that is removal of the tooth. So then arises a root canal treatment, which is nothing but saving the tooth. Like instead of extracting the infected tooth, if it goes to a pain or something, then probably we can perform a root canal treatment and save the tooth instead of removing it.
Okay.
So the success depends on the experts who does it, and it is a materialistic and about the you need to know the entire morphology of the root, and it should be a painless procedure as well.
So, doctor, what actually happens to a tooth that you need to determine a root canal
Yeah,
treatment?
exactly. The thing is, the decay when it starts with the enamel or it involves the dentin or something, maybe we can do a cavity filling. Cavity filling. If the decay is involving enamel, dentin, and a pulp, then the patient will feel a pain. So it arises the pain. So then, when it involves the pulp, then definitely it goes for a root canal treatment, where will be the root canal treatment itself is removing the entire pulp and filling up with the filling material so that the pain evolves out.
Let's get to the causes of root canal. Sir, what are the reasons that a tooth starts decaying?
The candy or something, any chocolates or anything which releases acids which attacks the enamel. So, in that way, the decay arises.
Let's move to the next segment. What do you think about dental crown in dentistry, sir?
Yeah, actually, when we go for a root canal treatment, the complete procedure is finished with the crowns, the dental crowns. Usually, many ask, I do the root canal treatment, but I don't want the crowns or something. It is not like that. The root canal treatment itself is complete with the dental crowns. It means why it is so important or something, because when we perform a root canal treatment or something like the inside, we are removing the complete tissues, the vital tissues have been removed.
Right.
So then becomes the tooth becomes brittle or something. So you will not be having a much of force or something to withstand. So when you without a dental crown, if you bite or anything so hard or something with the root canal treated tooth, the tooth might get tends to fracture. So for that we need a dental crowns. In that there are variation. There are many dental crowns have been, because when you the success of the root canal treatment, it depends upon the crown. So how important the crown is, there should be a proper margin fit, so that any food particle doesn't accumulate over there and produces and a second other decay to the adjacent tooth as well. So there are many patients, if there is not a proper crown is not been placed or something, the patient usually come with a dental pain after 6 months to the next adjacent tooth where the decay has arisen because of the constant food accumulation over there. And the knowledge will not be there with the patients seeking that this is not arise because of the improper crown or something. So that is where the dental crowns are more important. We have a lot of variations in that. So the crowns is more important, to be the proper crown has to be placed.
What are the different types of crowns that you can give to a patient, sir?
So it's like about the purely it's about economical, like how, because we have a lot of variations in crowns. The basic one is a metal ceramic crown. So where there will be a metal portion will be inside, and the top portion will be a ceramic one.
Okay.
And there is an all ceramic. It is a metal free. It's a completely ceramic, and it is made of CAD CAM technology. And these are the two variations where we have the dental crowns, and in that, based on that, the other segments are there based on the compressive strength and other things.
So the crowns that you just mentioned, are they customized based on the patient needs, or some one works better than others?
Yeah, definitely. The thing is, see, the metal ceramic crown is actually a two-layered. The full crown is made of a metal, and then the top portion is covered by a ceramic portion.
Okay.
So then it becomes a two-layered. Whereas in all ceramic, that is zirconia, it is made of a single block where you will not be having a. It's a fully ceramic. It's a single layered, so that the food particles will not be trapped into the margin. The marginal fit will be proper in zirconia.
Okay.
Based on the pricing, it is zirconia slightly higher than the metal ceramic. So a properly made metal ceramic crown is also better, equally better than this zirconia. It is all about the making. The crown should be a proper one.
So let's move to the next segment, importance of implants in dentistry. So what basically is an implant, sir?
So implants is nothing but a titanium screw which is placed inside the bone. That is actually, the thing is, if suppose if a patient has removed a tooth which is not, he has been an additional space is there, so it is previously extracted or something, then probably the question arises how he is going to replace it. So where this option of placing an implant, that is a single tooth replacement without disturbing the adjacent tooth teeth, then the choice of going for an implant. Implant is nothing but a titanium screw which is placed inside the bone, and it is allowed for osseointegration. That is, we need an initial of 3 months. So the minimum of 3 months for osseointegration, and then the second stage of giving the crown, which will be placed accordingly.
So can you explain what is osseointegration here?
So actually, the bone implant will be placed inside, and the formation of bone towards the implant. That is, it has to fuse towards the implant.
Okay.
So that is what the osseointegration is about. See, if an additional space, if you want to replace a single tooth replacement or something, then we this without, as I said previously, without involving the adjacent tooth. So the single tooth replacement would be a choice of going. The first choice would be the implant. Suppose in case if the patient wants to go for another without implant or something, most of them will ask because why they fear about implant, because it's a titanium screw drilling into the bone and other thing. But they ask for another options to go for, that is unnecessarily we reduce the tooth structure and give a bridge or something. So many patient doesn't know how important is the implant and what is the role of the bridge or something, because the bridge is a tooth structure which is completely trimmed off. That is, we have to reduce the tooth structure on either side and giving a bridge or something like that. But in implants, it is not like that. We are not going to disturb any of the tooth structure. It is just we are going to replace on that portion which is where the tooth has been extracted. So in what happens, even if you give a bridge or something, the extracted tooth where it is just a crown is being placed on the top of the gums or something over there. It is not going to have an underlying support of bone or something which where the implant does. So in that case, when you give a load or something, the bridge will not be having that much of strength compared to the implant.
That was a great insight on what are the technologies or what is the science behind putting an implant in dental care. So, sir, what are the advancements in anesthesia that will help the patient in terms of pain?
Yeah, actually, the thing is, previously we have an option of maybe a needle injection or something like where we give a local anesthesia. So the patient, any procedures we perform under the local anesthesia. So now the patient has got a choices of going it. In case if the patient is very anxiety and he has got a multiple dental treatments, then he apart from local anesthesia with the dental chair, they have in the same dental chair we have an option called sedation, the conscious sedation. The in conscious sedation will be sedating the patients and will be performing the dental procedures on the dental chair itself, so that the patient will not be having any pain or something. So the anesthetist will be accompanying and the procedure will be performing very smoothly without any pain or something. And there is another option of going for a general anesthesia where the complete pain, there is not be any pain at all, the procedures, whatever the, if in case if the patient has got a multiple dental procedures, so it will all be performed under general anesthesia and once visits.
Okay.
So we can, so that is what the modern dentistry are, the advancement towards the anesthesia.
So, sir, looking at the treatment plan, how frequently does a patient need to visit a dentist?
It's a very important question. Has actually many patients they visit only when the pain arises.
Right.
They come only with the pain or something. So there's no any proper awareness of how they come visit a dentist. In any treatment, before the treatment or after the treatment or anything, the it is more important like how they visit the dentist, because if suppose they usually does any get any previous treatment or something, so how and they never go back to a dentist until it gives a troublesome or any symptoms arises or something. So what happens in the, any dental treatment or anything, no, so the pain arises only after the chronic this thing. So actually, so what happens, it will be a very uh, long distance, so that the it will be a worsening part
Okay.
when the patient comes to a later part of the visits. See, the proper visits to a dentist is more important. The thing is, any procedure, if they usually gone underwent a thing, so it is not like that. Even if it is not giving you trouble or anything, you have to visit a dentist, get it checked done. Just with the, you have to inform the dentist as well. So we have done some procedures, and I just want to get it checked down. Like it should be a visit of 3 months, 6 months, or anything which is within the year. So if they have proper visits to a dentist, if they have a proper maintenance, then it will be a very helpful to the patients not having a further dental issues.
Doctor has very well explained what importance a follow-up visit plays and how does a doctor should be consulted when it comes to dental care or dental treatment. You can get in touch with the expert dentist on One Health Assist website, get a consultation done, and set reminder for your follow-up visit. As the doctor just emphasized more on having the record of all your medical records in place, we have a very good feature on One Health Assist platform. It's a health repository DigiLocker where you can store all your medical data in one digital format and it can be accessed given easily to the patient and to the doctor as well. So use this feature to the great extent and get care easily. What inspired you to become a dentist, doctor?
See, as everyone, even I would, as everyone, like even in the childhood, I had a trauma of being getting into a dentist,
Okay.
the dentist. But as it goes on, I had a choice of getting into a dentist. That is a choice of going into a BDS, Bachelor of Dentistry, and then from there I did my
Okay.
masters in root canal say endodontics, sorry, masters in endodontics and conservative dentistry. Since I had worked with the dentist previously, and this where I used to see my professor performing a procedure for the root canal, and this has got a challenging. It is not like I have done more than so far. I have done more than uh, 1 lakh root canal treatment. So in that, this keeps challenging each one of the patients, the morphology of the tooth, the way we treat the patients. It is all about the challenging. It's the success depends on the quality and how we treat the patients, and everything it matters.
So you love the thrill of becoming a dentist and treating the patient
Yeah,
so
definitely.
effortlessly, sir. That's
Yes.
really great to know. Can you share a story on one of the most complicated cases you have handled?
See, the thing is, usually dentistry, uh, it is all about when you treat the patients. We need actually, as a dentist, we need a lot of patients to treat them.
Absolutely, yeah.
So some patients doesn't open the mouth. It should be mouth opening will be very restricted or
Hmm.
something, and they have the more salivation of it, and it will not be more comfortable in performing the treatment or something.
Right.
So it depends. Each patient's it varies. Another thing. So in that, it is very difficult to treat a molar
Hmm.
if the mouth opening is restricted or
System.
something. In that case, we need a lot of patience to do perform the procedure. The root canal treatment is not as easy as that. It is not a superficial treatment or something. It is something which is very deeper into the canals. So the morphology is totally varies, and it is all you need to accumulate your materials properly, and you have to do it properly.
So next time when you visit a dentist, you know for sure that the doctor will treat you with a lot of patience and a lot of care. Let's move to the last segment. How do you feel that the platform like One Health Assist has helped you so far?
One Health Assist helps me in documentation and prescribing the medicines to the patients, and it sets reminders to the patients for an appointment, so that the appointments doesn't get delayed, and the patients are on time.
This brings us to the end of the podcast. Thank you so much, Doctor, for all your insights on the topic that we had today on implants and root canal. That was nice of you to share all the details with us.
Thank you so much.
This is your host, Deena, signing off for now. Stay tuned. Please like, share, and subscribe.